Welcome to the Empowerment Show. The Empowerment Show aims to equip individuals with the necessary tools, knowledge, and confidence to make informed decisions and take control of their lives. It also focuses on ensuring access to essential resources and opportunities.
All right. Good evening, and welcome to the Empowerment Show. My name is Kendall Stevenson, and I will be the host for the show this evening. We started out the show a little late. Sorry about that. Had a little technical difficulties, but we do have a doctor here today, and her name is Dr. Fan, and we're going to go through questions, the Q&A about cancer. Hello, Dr. Fan. How are you?
I'm good. Thanks for inviting me.
Thank you. Thank you very much for showing up and willing to give your information out. So we're going to start off with the first question of how did you get into this and why?
Yeah, so I became interested in oncology or the study of cancer in college. I was a biology major. I studied a lot of cellular biology, and cancer cellular biology is very unique and very complex and fascinating. And that started some research that I did back in college when I went to medical school.
Wow, try it again.
Yeah, I explored
Can you hear me?
oncology as a field and, really fell in love. And that's how I became an oncologist.
Okay. Did any of your family members have cancer or anything like that? Something to inspire you to do what you do?
No, I think, I've been lucky, so I haven't had a lot of cancer in my family, at least not ones that I've interacted with directly. More of my journey was just the study and becoming a doctor and working with many different kinds of patients throughout many years.
Hmm.
And it was oncology that basically spoke to me the most. The patients in cancer treatment were the ones that I connected with the most, and that's how we ended up here.
Just so people would know, I hear the word oncology. Exactly what does that break down to mean?
Yeah, so oncology means the treatment or the study of cancer. So when we talk about oncology, we're talking about cancer and the study of cancer. If you're talking about the ecology department, you are talking about the cancer department, which is made up of three major branches: surgery, chemotherapy, or they're called medical oncology because they have a lot of other drugs besides traditional chemo now, and radiation oncology. And that's what I am. I'm a radiation oncologist. I use radiation to treat cancer.
So by the time a person get to you, they've pretty much already been diagnosed with cancer.
Yes, the vast majority of patients have been diagnosed, worked up on the outside, and they are ready to start treatment with us.
So is all cancer curable?
No, no. Unfortunately, there are plenty of cancers that are not curable. There are cancers that you try for cure always whenever possible, but the prognosis is guarded or poor, and you don't. Cancer is a living thing, and so it's something that we have to deal with. There are patients who should not live very long, who live a very long time. There are
Hmm.
patients who should do very well, who do not. There's an element of unpredictability to it, and not all cancers are curable.
My Lord, wow. What types of cancers are not curable? I mean, you have the basic. You have breast cancer, prostate cancer, cancer of the pancreas. I guess there's many places that you can get cancer because it's what is it, a tumor?
Yes. So cancer, basically, by definition, is a tumor that has developed invasive capabilities and thus can spread. And it can arise from almost any cell in our bodies. And so you have many, many types of cancers. Some cancers are curable if caught early enough. Most cancers, if caught very late, are typically not curable. Uh, you brought up breast and prostate
Early enough?
cancer. Early stage
Mhm.
breast
Most
and
cancers,
prostate
if caught
cancer
very
are
late,
very
are
curable
typically
for
not
many
curable.
patients, but
So,
stage 4 is not.
but you brought up breast and
Yeah, so then there are some cancers that have very, very poor prognosis, such as pancreatic cancer or GBM, which is
Mhm.
the number one most common adult cancer of the brain. It's what Biden's son died of.
Oh.
Yeah, so that cancer is pretty lethal. There's almost no cure rate. The improvements in treatment for that particular cancer have extended life and quality of life for many patients, but they don't have long-term survival beyond, I would say, 2 or 3 years.
Uh, so what would you say the how do I want to put this? Which cancer is most treatable?
Early cancers, for the most part, are most treatable cancers. It's one of the reasons why we advocate for screening so heavily. Basically, the most common cancers out there are things like prostate, that's number one in men, breast, number one in women, colorectal, number three or four, basically everywhere. These cancers can all be screened for. And when you catch them early, they often have very high rates of local control and cure. They often need a lot less treatment, a lot less surgery, a lot less drugs, a lot less radiation to get that same prognosis and same cure rates. Um, but if you catch them very late, then it's much harder to control them. They often need a lot more treatment, which is a lot more toxic for patients. And then it's just very hard to control once they spread. So, having said that, there are new drugs every day. So, on the horizon, there's been improvement for breast, there's an improvement for colorectal, there's been improvement for prostate, stage 4 patients. So that means
Hmm.
that your cancer is spread outside of the organs and nodes to other parts of your body. So a classic example is prostate cancer spread to your bones. That's
Hmm.
stage 4, that's not curable, but it is very treatable now, and you can keep men going sometimes for years, in pretty good shape, just depends. And that was not possible when I started training 20 years ago.
Hmm. Ron, did you have a question that you wanted to ask the doctor?
I do.
Okay.
I wanted to ask her actually two questions. The first question is, yeah, can you hear me?
Yep.
Yes, yes, you can. We can hear you just fine. Ron.
Yeah.
Ron.
My first question is, as it relates to, as it relates to cancer treatment and what is most effective. So, my wife is a survivor of, I believe it was HER2 negative breast cancer,
Okay.
and when she was diagnosed, I started doing a little research, and I found that there was a doctor who was an oncologist in the mid 1930s who had discovered that certain sound waves were highly effective in stopping cancer from metastasizing and actually arresting it and basically curing the people.
Mhm.
When the medical establishment found out what he was doing, they sent him patients that were incurable by the medical establishment, hoping that he would fail and that they would basically run him out of business.
Mhm.
But actually, what the treatment protocol he used worked. But because he was a threat to the medical establishment, they basically drove him, out of business
Mhm.
by discrediting him. So
Mhm.
are you familiar with that research?
So I am not familiar with sound wave research for breast cancer. I will say that there are a lot of things that we consider alternative or kind of questionable that have actually, when their time came, became mainstream. So I would say the classic example of that is immunotherapy, which is basically drugs that prime your own immune system to go after cancers. These are the Keytrudas and Nevos and some of those other drugs that are out there. This was first described, I think, in the 1900s, where there was a scientist who actually went and he would infect people and have them, like, have these terrible sort of infections and fevers. And but then he noticed that a certain percentage of them, they had tumors that disappeared. And that they were called, I think they were called Coombs or Cooley's like theory, and that actually got discredited by the mainstream. He was basically like his theories just got buried, and that, but and to be fair, infecting people with life-threatening illnesses was probably a different kind of issue. So it probably wouldn't have flown in that form. But in the end, immunotherapy is revolutionary in our oncology field, and it is based on the same principle of ramping up your own immune system to get it done, but now in a more controlled manner. Um, so, in terms of sound theory, I have not heard of that theory for breast cancer. I'm not aware of it. Um, in general, I personally do stick mostly to standards of care, which for breast cancer you probably experienced are different kinds of hormone therapy, different drug therapies, radiation, surgery, depending on what the situation is. I will say that breast cancer in particular is a field where the drugs come out fast and furious. So, is it the best treatment? I don't know, but in terms of like, are there really great breast cancer treatments? Are they coming out with new treatments all the time? Yes, that is true. That is true. Will they come up with something even better in the future? Probably. Will that one day incorporate sound waves or other things like electrical alternating fields, which is used in brain tumors and lung cancers? Maybe, but it will take a little bit of time. Until then, just to reserve toxicity of treatments and try to get the best outcomes that we can with what we have. I personally still stick to standards of care.
Okay. Just wanted to ask you another
Mm.
question. I want to let people know that men, they do get breast cancer. Is this not true?
Yes. Yes, it is. So breast cancer in men is rare. It's something that whenever we see it, we typically will test for genetics because it is so rare. But especially when men who have genetic mutations or have families with very strong histories of cancer, they can carry mutations that make them prone to it. The treatment is very similar to what we do for women, and outcomes tend to be good. Mostly because a lot of men are able to catch it pretty early, because
Hmm.
they can feel it, but they don't get mammograms. So if you've got a lump, you should be checked out.
Okay. Now, I notice also a lot of men, they with the prostate cancer.
Yes.
It seems to be a growing thing that I see. I see more and more men, African American men, for some reason. I guess they don't like to go to the doctor too often. But how early should men be checked out before so they get a proper diagnosis?
Most family doctors will start screening, I believe, at the age of 50, 55 plus, depending on your family history. I want to say it's come down to 50 when they start your first PSA screen. So, prostate cancer screening is primarily blood tests these days. It's usually done by family doctors, it's usually annually. African American men often have, so when they do prostate cancer screening by blood, there's a threshold number where they consider normal. But this normal number is actually variable depending on you, because some men have really big prostates and their PSAs are always high. African American men have shown that they can have prostate cancer at lower. This blood test is called a PSA,
Mhm.
lower PSAs than what is typically used, because that PSA threshold was established a long time ago, primarily on Caucasian men, which was the
Yeah.
primary study. And so and if you have a family history, like a strong family history of prostate cancer, like your dad was diagnosed at a young age, then you typically will start screening 10 years before that time.
So you're saying around 40.
Yeah, so if you had your father was diagnosed in their 50s, that's really young for prostate cancer. Most prostate cancer men are 60s, 70s. If they started in their 50s, then you would start in your 40s. If they had it in their 60s or 70s, you still need screening, but you could probably start at a regular age. but you should have screening. There are protocols out there where they try to discourage you from having annual PSAs, but if your family history is strong, you should be screened.
Screened. You mean like a genealogy test?
No, I mean like a PSA. A PSA is, typical, but if again, for African American men, you may have a slightly lower threshold for further workup than like a 4.0
Mm.
threshold, which is a standard kind of thing.
No, it's just that you said it could be inherited.
That's
It
right.
could be passed down. So
It can be
I would
passed down.
right. So if you don't know who your or what your parents may have, because sometimes the parents don't divulge this information to the children. So I would suggest that they take a genealogy test.
They can. So, I mean, there are people who do sort of right now there's there are big projects all over the country. There's one at St. Luke's, and other places where you can join like a genome test, a genome project where you basically sign up and they like run all your genes and they look for risk factors or mutations that might make risk factors. um, and some people have found that they needed more screening, and some people have not. So but that is actually available as
Mhm.
well.
Mm.
Mhm.
Yeah, I took a genealogy. I wasn't sure about my family history, and as you know, I had prostate cancer. I guess I'm in remission now. Let's hope, right?
That's right. Yeah.
Fingers crossed, right?
Yeah.
So the treatment so far that I can tell you, it's the radiation, the treatment itself is pretty painless, and it's not a lengthy one. You're in there for about 10, 15 minutes and you're out. But it's like going to work because you have to be there every day.
Yes.
Hmm. And
Mhm.
you get to see the technicians that work there. Now at the hospital I was at, I think the people there are fantastic. So and I want to say thank you, and I'm very grateful for the treatment that I received while I was there. Okay.
I'm glad that you had a good experience. That's always our goal. We know that cancer is a tough thing it's tough. And the treatments, although they're painless, they're long. It's a hard journey. So I'm glad it was a good one.
Mm. So what are some of the side effects to radiation
So
treatment?
radiation is a local treatment and you have local side effects, except for tiredness, which is very common with this type of treatment. So, depending on where you get treated, that's where you tend to have side effects. It's often an inflammatory response.
Hmm.
So, for example, if we talk about prostate cancer, the most common side effects are urinary because your prostate sits underneath your bladder. So the bladder gets some inflammation, the prostate's inflamed, your urethra runs through it, so that's inflamed. And that can mean like urinating more often during the day, urinating more often during the night. When you need to go right away. Some men have like a little bit of burning. Your rectum or your bowels are in that area. They're very sensitive to radiation, so they can get inflamed as the treatments go on, and you can have some diarrhea with that. After the radiation is done, a lot of this inflammation usually dies down and a lot of people will feel better. The tiredness gets better, but there is a scarring component that happens afterwards. And so sometimes you'll see men who have things like for prostate cancer, erectile dysfunction, or let's say GYN cancers, they have vaginal drying and scarring, which doesn't feel like anything to the woman, but if she's sexually active, that becomes painful. It can happen in the throat. So when we treat neck cancers, they can have a lot of scarring that has problems with the swallowing or like muscle stiffness. That's not uncommon.
Hmm.
That's something you see with long-term radiation changes. What makes radiation a little bit special as well is that radiation is a known carcinogen, meaning that it
Hmm.
itself can cause cancers. So we are often used in older adults or just adult population where the risk is very low. In children, you try to or young people who can get childhood cancers or Hodgkin's lymphoma, which is very common in early 20s. Then those people you try as best you can to limit radiation or eliminate radiation, because a lot of these cancers now have very high survival rates, and they go on to live to have basically secondary cancers from the chemotherapy and the radiation that they get. So whenever possible, we're always trying to cut drugs and cut radiation out of their treatments. We do the same for adults, but it's not as critical in terms of like secondary malignancies. And adult cancers do tend to be a little bit more resistant as well, so they need a little bit more.
I hear about a lot of herbal medication or that that they take in order to prevent themselves from cancer. It's
Yeah. So I don't, so I, so like there is a big movement out there regarding, eating clean, sort of, trying to reduce risk of cancer exposures. And I think that, there's really data supporting that. It can be difficult to do. In terms of supplementations, is that going to help reduce cancer? I think that there are known things that help reduce the risk of cancer out there. Coffee for liver problems, antioxidants, again, eating clean and trying to reduce, carcinogen exposure. All of these things are helpful. Um, but in modern society, I find that it is actually quite difficult to avoid all carcinogenesis. You don't even know where they are sometimes,
hmm
and they're
hmm
usually like low levels. And there's no like herb or supplement where it's going to give you a guarantee or even like a massive amount of protection.
I have
So
another question for the doctor.
yeah,
He's got one more question for you.
yeah, go ahead.
I think she can hear you. All right,
Okay.
Ron.
You mentioned diet,
Yeah.
and my question is, what what is the effect of say for the American diet? Does that contribute to the high prevalence of cancer in this country? Because you find in other countries the the cancer rates are not as high because their diet is much different than ours.
Yeah.
So
So
it does the American diet contribute greatly to cancer?
I think the American diet, unfortunately for us, it contributes to many health problems, and cancer. I personally feel is probably in there. It just and it, depending on which cancer you're talking about, it affects it in different ways. So, I mean, if you talk about an obvious one, it would be colorectal cancer, where eating a high fiber, low, kind of um, protein diet, which is the opposite of the American diet,
hmm
low processed foods is helpful and has been shown to be protective for colorectal cancer. Um, so in certain countries, that's a given. Microbiome, I think another major area of research now, which we don't talk about in my office because that we're focused on actual drugs and stuff. But I know that out there they've got talk now about like how critical the microbiome is and balancing the microbiome of your entire gut flora from mouth to rectum, and also helping like reduce risk of colorectal cancers because it reduces inflammation. I mean, that's your classic example, but I'm sure it applies to other things as well. But I'm no specialist in this field. It's just something that's out there, and it's probably affecting us.
Yeah. Well, I think diet is very important, and a lot of the cancers they could be environmental as well.
Yeah, yeah. I mean, your number one is still smoking. So,
hmm
yeah. I mean, that's still a big one. Um,
hmm
yeah, that's still a very big one. Um,
Do you
and
still
it's
find a lot of people have lung cancer?
yes, yes. Lung cancer is still very prevalent. I mean, you can see their smoking is not helpful. It is the major risk factor. Smoking is a major risk factor for bladder cancer, head and neck cancer, um, cervical cancer, almost like pick a cancer,
Pardon
and
me.
it's a risk factor. It also doesn't help that in Pennsylvania we live in the radon belt. So I don't know if you guys have ever heard of this, but there's some radioactivity that comes from the ground where we live,
Really?
and
I didn't
that's
know that.
yeah.
Did not
So
know
if you
that.
yeah, so if you've ever seen people like buy houses around here and they say, "Oh, I want
Yes.
radon testing or remediation,"
Mm,
so that is because radon is a natural, like radioactive gas that comes from the ground. And there is a belt where we live. And basically it comes up and it kind of collects in a base, like it collects in closed areas. So if you vent your basement or you open your windows regularly, then you circulate. But our houses are so well insulated at this point that a lot of times you don't get that, and so you inhale this radioactive gas and then it decays. And when it decays, it becomes a radioactive like solid that then stays in your lungs. So that's another cause of cancer. It is believed to be the second most common cause of lung cancer, especially in non-smokers,
mm,
along the radon belt. So radon remediation is pretty straightforward. Anybody can test for it, and it's a pump that you get to like pump the air out of your basement now and then because it's a heavy gas, so it tends to stay in basements and stuff like that. But
mm.
um, it's a real problem actually in the Lehigh Valley.
So if you say it's a heavy gas, can you
Yeah.
smell it?
Mm-mm.
Can't
Mm-mm.
see it, can't smell it.
Mm-mm.
So
Mm-mm.
it's invisible.
Mm-hmm.
So the only way to know is that you would actually have to test for it.
You'd have to test for it. There's this pretty, it's in very small quantities in general. So if you just honestly, if you just vent your
They
for our
actually have
living own
radon
living spaces, if you just
detectors.
vent it, yeah, radon
Mm,
detectors, yes, radon detectors are used.
mm.
But
Okay,
and vent, like just vent your home now and then, and it will help.
okay. I guess the guest, he doesn't have any more questions for you.
Okay.
Well, actually, I do.
Okay, yes, he does. He's back.
Yeah.
Ron, what do you got?
Well, there is a billboard in Manhattan. I don't know, Dr. Fan, if you've seen it, but it said within the next, say, 15, 20 years, half of the American population will have cancer. One of the major drawbacks, I don't know if drawback is the right word, but one of the major problems is there's the treatment side of cancer and then there's the economic side of cancer. Cancer is a multi-billion-dollar industry.
That's right.
So for the average person, we want to find a cure to eradicate this disease.
Mm,
But of course, there's the business side of it, where billions of dollars are made just from the treatment alone, the surgery, the treatment, it all adds up. When my wife was dealing with cancer, she had to take a drug called Neulasta,
Yeah,
which was supposed to boost her immune system.
supposed to.
One
Yes.
small injectable, about the size of the average writing pen, was $6,000 for
Yeah.
one dose. Fortunately, my insurance company, good insurance, paid for it. But we encountered people who were coming to the cancer center who had to pick and choose what treatment they were going to receive because they simply couldn't afford it, and their insurance company would not allow them to take some treatments because they said it's experimental.
mm. I think that would be a question though for the insurance people. Dr. Fan she deals with radiation. She really doesn't deal
Well,
with
you know what?
the
It's for
cost.
doctors too,
Mm.
because doctors. My cousin is a retired doctor, and he was restricted to what treatment he could give his patients
Are you
because there
restricted
are
for
insurance
treatments?
companies that
Uh,
have non-trained people that are going to make decisions on what treatment you are allowed to receive. Even though the doctor says it is necessary, someone will say, no, it's not necessary, and they have no medical training whatsoever.
Yeah, so in terms of like, I can't speak to everything in terms of like the pharmaceutical, big pharma. It's it's its own huge topic. You can discuss at length about it. Cancer is a multi-billion-dollar business. That is true. these drugs that you get are extremely expensive. Radiation is very expensive. And in general, it's, covered for indications. But in terms of like, do we have to fight sometimes in terms of what we give our patients uh, as opposed to like what the insurance company wants to give or what they are willing to pay for. Yeah, so we do that on a regular basis. In terms of usually if it's straightforward and proven, then it's not an issue. Sometimes we'll get pushback because we want to use a different technique of in radiation world. It's usually a technique or some type of special imaging as opposed to drug. And so for us, we have to prove to them that it is necessary. So we do have that fight. We usually win that fight. But if it's if push comes to shove, the radiation treatments may have to be modified somewhat to account to get the insurance clearance because it's almost unaffordable otherwise. So um, I haven't had to modify my treatment significantly in a very long time. But I do understand what you're saying and where you're coming from, and it's a very real thing. And we do, as doctors, go up against the insurance companies on a regular basis.
So again, I just like to let the viewing audience know that there, especially for young men, if you have a problem within your family, just make sure you get checked out. Maybe starting at the age of 40. Your normal age would be 50 years old. And for women, make sure you get your mammogram and your Pap smear and all the different things that you need: a CT scan, a MRI, whatever it is that you need to detect the cancer as early as possible, so it can be cured. I'm very thankful for technology because at one point in time, cancer was a death sentence. You said I had cancer, you were pretty much on your way out. And for a lot of men, by the time you get symptoms or you start to feel the symptoms, you're probably in stage 4. So
Yeah. So yeah. Hmm.
yeah, I
Yeah.
would suggest that the young men you get checked out as early as possible. Okay, Dr. Fan, thank you very, very much for coming on to the show, and
Of
it's
course.
been a pleasure for you. As you know, the show we do it a half an hour, 30-minute show, but I like to pick up part 2. So if you want to come back on, we can pick up part 2, and we can talk a little bit more about radiation and cancer.
Yeah, whenever you would like. And if you like, I can ask some of my colleagues who are specialists in special techniques of radiation if your audience has any interest in that, because there's different types of radiation. So you experienced and what we talked about today is the most common type of radiation, but there are actually special types of radiation out there that we do as well.
Mm. Okay, well, we'll pick that up on part 2. We talk about that special radiation that's out there. Okay.
Okay.
Again, thank you very much. This is the Empowerment Show. My name is Kendall, and I'm glad you guys decided to tune in. I hope you guys got some good information about what's going on with cancer and radiation. And tune in next week. Next week, 6 o'clock, we have a young lady coming in. Her name is Kira Bradford Gray, and we're going to chop it up a little bit about politics. Okay, so this is Kendall Stevenson saying thank you, good night, peace, and we are out.